All right, welcome to your guide for week 34 of pregnancy. This is a huge milestone, really. It's a time when both you and your baby are in the absolute final stages of prep for the big day. So let's dive in and see what's happening.
Can you believe it? 42 days to go. The final stretch is officially here. From this moment on, pretty much every development, every little kick is all about one thing: getting ready to finally meet your baby.
And wow, just look at this incredible image. At 34 weeks, a 3D scan shows you just how much your baby looks like, well, a baby. You can see their features so clearly. They are just so close to being ready to meet you.
So, what's really going on in there? Let's take a closer look at your baby's world and all the amazing things that are happening right this very second.
So, at your doctor's appointments, you might start hearing a couple of new terms: lie and presentation. It sounds super technical, right? But honestly, it's pretty simple. It's just your doctor's way of describing which way your baby is oriented and what part of them is closest to the exit.
And this is a great visual for it. On the left, you've got the cephalic, or head-down position. This is the ideal setup, the one we're all hoping for. It's the most common position for birth, partly because the baby's head is their heaviest part, so gravity kind of gives a helping hand. And then on the right, you can see the breech position, which is where the baby's bottom or feet are pointing down instead.
Okay, and this is so cool. Your baby's world is actually getting pretty noisy. Their hearing is well developed, and even though some sounds are muffled, voices can penetrate pretty easily. They're already getting used to all those repetitive sounds, like your heartbeat, and most importantly, your voice. They're actually forming their very first memories in there.
So, what this all means is your baby is putting the absolute final touches on all their internal systems. I mean, their digestive tract is pretty much ready for business, and those lungs are maturing every single day. At the same time, the amniotic fluid around them is starting to reduce a bit, which is why you might feel those kicks and stretches a little more distinctly now. And of course, they're getting all that nourishment directly from your body's reserves.
Okay, so the baby's doing a ton of work. Let's switch gears and talk about you. Because now, more than ever, it is so important to look after your own health and well-being. This is why those regular prenatal checkups are absolutely non-negotiable right now. Your doctor is on the lookout for a condition called preeclampsia, which can affect both you and the baby. They're watching for this specific combination of signs: high blood pressure, protein in your urine, and some pretty significant swelling. Catching it early is so important.
Okay, let's tackle a question that comes up a lot around this time. What is perineal massage, and does it actually help? It's a self-care technique a lot of women consider in these last few weeks. And you know what? The research shows it can be really beneficial.
So how do you actually do it? Well, it's pretty straightforward. The whole goal is to increase the elasticity of the perineum. That's the area between the vagina and the anus, to help reduce the risk of tearing during birth. As you can see, you start by getting prepped, then you gently insert and stretch the tissue till you feel a slight stinging sensation. You hold that stretch and then gently massage. Just 5 minutes a day can make a real difference.
All right, another super practical tip for something that suddenly feels, well, impossible. Just getting up. This yoga-inspired technique is a lifesaver for your stretched abdominal muscles. Instead of trying to sit straight up, the key is to roll onto your side first. From there, you line up your hands and knees, shift your weight, and then rise up slowly. It's all about using your arms and legs for support, not your core.
And you can see exactly what I mean here. Instead of that direct sit-up motion, you roll and push. It just takes all that pressure off your abdomen and works with your new center of gravity, not against it. It's such a small change, but it makes a huge difference. All right, let's dive into a couple of specific scenarios that some of you might be experiencing. What if you're expecting twins? Or maybe you're planning a home birth? Well, your preparations might look a little different.
So if you're carrying twins, you probably already know that your timeline often shifts. While a single pregnancy goes about 38 to 42 weeks, an optimal twin pregnancy is closer to 37 to 39 weeks. Actually, more than half of all twins are born before that 37-week mark, and there's a higher chance you might need a cesarean delivery.
And that brings us to size. As you see here, 5 pounds, 5 ounces is the average birth weight for a twin. Now, to put that into perspective, the average for a single baby is closer to 7.5 pounds. And hey, don't be surprised if one twin weighs a bit more than the other. That is totally normal. Here's a question that twin parents-to-be ask all the time. Can they share a crib? I mean, after spending months crammed together, it seems only natural, right? And the good news is, research actually says yes. It's considered safe for twins of a similar size up to about 3 months old. It can even help regulate their body temperature and sleep cycles.
Now, if a home birth is your plan, you know that preparation is absolutely everything. This checklist is a great starting point. You'll want to get all your supplies together, stock a fridge, and arrange childcare. But honestly, the most crucial tip, have a hospital bag packed and ready to go just in case plans need to change. Being prepared for every possibility is just so important. Okay, we are officially in the home stretch. So let's talk about some of those last-minute decisions and practical tasks you'll want to tick off your list before labor begins.
So, a big one you might be wrestling with right now is, when do you start your maternity leave? I know a lot of women want to work for as long as possible, but that late pregnancy discomfort is very, very real. If you're struggling, talk to your employer. Maybe working from home or starting your leave just a little bit early is the right move for you.
Hey, while we're talking about hospital bags, don't forget your partner needs one too. Labor can be a marathon, not a sprint, and they need to be self-sufficient. So pack snacks and drinks to keep their energy up, and something to pass the time during any quiet moments. Oh, and don't forget the practical stuff, like change for the parking meter and, of course, a camera to capture those first unforgettable moments.
Wow! Okay, we have covered so much ground today, from your baby's development to your own well-being. As we start to wrap this up, let's focus on one last piece of preparation. I love this quote because it really gets to the heart of it. Your mental state has such a powerful effect on your physical experience during labor. So from now until the big day, really try to take some time every single day to practice your breathing and relaxation techniques. Seriously, training your mind to find calm under pressure might just be the most powerful tool you bring with you into that delivery room. Week 34 is all about those final preparations. Your baby is almost ready, your body is almost ready, and now it's time to get your home and your mind ready. The final countdown has officially begun. In just a few short weeks, your entire world is going to change forever. The only question left is, are you ready for that first hello?